Hello.
Hand hygiene. I'm washing my hands. Hi, my name is Leticia Martinez, and I am a Harper College nursing student, and I am here to do a head-to-toe assessment. Is that okay?
Yeah, it's fine.
All right. I'll start by asking you, what is your name?
Roy Toronto.
Do you know where you are at the moment?
At the pavilion.
Do you know what day it is?
Wednesday the 25th.
And do you know why you're here?
For an assessment.
All right. So my patient is alert, and he is oriented ×4. And his speech is clear, and he is able to respond to my questions. His overall skin color for the moment is appropriate. There's no jaundice, erythema, pallor, or cyanosis. I have taken his vital signs. His heart rate is 70. His respiratory rate is 20. His blood pressure is 122/80. And his temperature is 98.7. His height is 5'8". His weight is 140 pounds. And his BMI is 21.3, which is normal. In order to test cranial nerve number 2, I would have used a Snellen chart for the vision. I then will move on to inspect his head for size and shape, which is normal cephalic. I will inspect the hair, which is evenly distributed. It's nice and soft. I will inspect and palpate the head, the scalp, for any protrusions. I'm looking for any infestations, none is present. I will then look at his face. I'm going to look at the eyebrows, the eyelids, nasolabial folds, and sides of mouth for symmetry, cranial nerve number 7. I will then palpate the temporomandibular joint. Can you please open your mouth and close? All right, and there's no crepitation. I will palpate the maxillary sinus and the frontal sinus. Okay. I then will look at his conjunctiva and his sclera. Conjunctiva is nice and pink, sclera is white. I will then test cranial nerve 3, 4, and 6, and I'll start off with the pupillary light reflex. I'm going to shine a light. If you can please just look at my nose. And I'm looking for constriction. And they constricted. Then I will do the, follow my pen please, accommodation. And then 6 positions of cardinal of gaze. Can you follow my pen with your eyes only?
Mm-hmm.
Okay, and his pupils are equal, round, and reactive to light and accommodation. I will then check his ears, and I'm going to inspect his ears first for any lesions, any abnormalities, anything abnormal. I'm going to palpate for any lumps, anything abnormal. I'm going to look at the auditory meatus. Okay, and everything checks out. I'm going to check cranial nerve number 8 by doing the whisper test. I'm going to whisper something. You can please repeat it back.
All right. Good night. Hello.
All right, and it is intact. I will then check cranial nerve number 11. And can you please shrug your shoulders up against my resistance? And he is intact. If that is intact, can you push your face against my hand? Okay, and it is intact. And then I will inspect his mouth. I'm going to look at his lips. They are not dry. They are not bleeding. They're nice and pink. Can you please open your mouth? I am inspecting. Can you show me your teeth? Looking at teeth, and I'm looking at the gum for tightness on the margins. Looking fine. Teeth are all present. Open your mouth. I'm looking at buccal mucosa, nice and pink. I'm looking at the dorsal side of the tongue. Can you stick your tongue out? And it's nice and pink. I'm looking at the ventral side. Can you lift up? And there's veins present. I'm looking at the floor of the mouth. It's nice and pink. And then I'm looking at the tonsils. Tonsils are not visible, which is normal. Can you please stick your tongue out? That's cranial nerve number 12. Tongue is in midline. I am also looking, open your mouth. I am also looking at the palate and the uvula. Can you please say ah? I'm checking for cranial nerve 9 and 10, and it is intact because of the palate and the uvula rise. All right, you may close your mouth, and then I'm going to check the neck next, and I'm going to check for the parotid glands, the salivary glands, and the thyroid for enlargement, and they are not enlarged. And then I'm going to check for I'm going to check the lymph nodes, so I'll check the preauricular, postauricular, occipital, submental, submandibular, jugulo-digastric, superficial cervical, deep cervical, posterior cervical, and supraclavicular. Can you move your elbows in, your shoulders in?
No.
Okay. And I do not feel any of the lymph nodes enlarged, which is normal. I will then ask you to turn your head to the left, right, up, down, and your ear to shoulders. Just your head, not your shoulders up to your ear.
Oh.
No, just your head down.
Sorry.
Again, the last side. Okay. And then I'm going to check for... Then I'm going to check his overall skin. If you can please take off your shirt. Alright, and I'm looking for any jaundice, erythema, pallor, or cyanosis. And I'm looking for any lesions as well. I do not see any. I will then start with the upper extremities. So I'm going to ask you to stick your hands out in front of you. Now, move your wrists down, up, and now move your fingers down and up. Alright, and then can you grip onto my fingers and pull? Okay. And then can you flex your elbows? Alright, and then can you push against me? And now can you pull against me? Okay, and then can you stand up for me? And can you put your hands out in front of you and over your head? Behind your head? Cross your hands. Alright, and now up and out to your sides. Put your hands out. And now to the back. And cross your hands. Alright. And then you can sit down. Alright, and then I'm going to, can you put your hands palm down? And then palm up. And hold them out. Good. Alright, now put them down. And then I'm going to check your... I'm going to start with your, I'm going to check your carotid pulse. So I'll start one by one. Okay. Present. Now I'm going to listen to the artery with the bell of my stethoscope. I'm going to assess it. Okay, can you please take a deep breath and hold? And I'm listening for any bruits. Let go. And I don't hear any. I'm going to check the other side. Now can you please take a deep breath and hold? Okay, no bruits. Now can you please lay down for me? Patient should be at 30 to 45 degree angle, and I'm going to check for jugular vein distension. Turn your head to the side, please. And to the other side. Alright, you can sit up and there's no distension. And I'm now going to alright, check your lungs. So can you please take a deep breath in and out? Again. And there's 5 sides in the front. Again. 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 If you can please stand up and turn around for me. And there's 9 sides in the back that I'll be checking. Take a deep breath in and out. Again. 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 And one last time. Okay. You can sit back down. So respiratory rate and depth is normal and the rhythm is regular. I will then listen to the heart, and I'll start off with the diaphragm. Sorry, at the top you would hear vesicular breath, bronchial breath sounds. In the middle you would hear bronchovesicular, and towards the lower part of the lobes you'll hear vesicular breath sounds. I'm now going to check the heart, and I'll start off with the aortic side. I'm going to listen. Pulmonic. Tricuspid. And mitral. And I'll listen to the same with my Bell stethoscope. Aortic. Pulmonic. Tricuspid. Mitral. Alright, and I was able to identify S1 and S2. I did not hear any heart murmurs or extra sounds. I will now listen to apical heart rate. Rate and rhythm is normal. I will now ask you to lay down, please. And I'm going to inspect the abdomen, and I'm looking for the contour, which is round. I'm looking for the symmetry, which is symmetric. I'm looking at the umbilicus, it is midline. And I'm looking for any lesions, and there is none. And then I will listen to the bowel sounds in all 4 quadrants. Okay, and I'm going to listen with the Bell stethoscope. I'm going to listen to the aorta for any bruits and the renal arteries. Okay, no bruits were present. I will now start with light palpation in each quadrant. And then I will do deep palpation. Okay, and everything seems normal. You can sit up for me. Then I'm going to go down to the lower extremities. Can you lift your legs up for 10 seconds? Okay, and now can I have you lay all the way back, please? With your feet up, all the way back. All right, so now I'm going to have you lift your leg up, down, and sideways, back, and then can you flex your knee and turn it inwards? That's outwards, inwards. Now do the same with the other leg, inwards and outwards, and do the same with your feet, inwards and outwards. And then can you push against my hand? Push against my hand. All right. And then can you press on me like a gas pedal? All right. And can you move against my hands upwards? Okay. I'm going to test the capillary refill on the toes, which is less than 3 seconds and is normal. I am then going to test the Babinski sign, and I'll do that by running something Okay, and his toes went inwards, which is a normal response. I'm now going to check for pretibial edema, which there is none present. And I'm feeling the skin temperature, and it's nice and warm, and skin is smooth. Also, up in the upper extremities, skin temperature is nice and warm, and skin is smooth. Capillary refill in each finger is less than 3 seconds. Same on this hand, and I'm checking the profile sign for clubbing, and there is none. I'm also palpating and inspecting the nails. The nails are nice and firm. The nail beds are nice and pink. I will then you can please stand up for me. I will then ask you to walk a straight line. Okay, turn around and walk heel to toe. Okay, turn around and touch your heel to your shin, to your opposite shin. No.
Oh,
What are you
heel to
doing?
shin.
Yes. Okay. Okay, and now I'm going to ask you to close your eyes, and I'm going to perform the Romberg test. And looking for loss of balance, which is not there. Okay, open your eyes, and now if you can turn around and bend over and touch your toes. I'm looking for symmetry of the shoulders, scapula, iliac crest, and gluteal folds, which is symmetric. Okay, go ahead, stand up. And I'm going to hold on to your hips. If you can please move side to side. No, your body.
Oh.
Turn side to
like
side.
this.
Yeah. I mean, now turn side to side. Not side.
Oh.
Yep.
Like that.
Yeah.
Sorry.
You're fine. Okay, and that is fine. And then I'm going to ask you to sit down. I'm sorry, stand up. The thoracic has a concave curve, and the lumbar has a concave is lumbar, convex is the thoracic. Okay, sit down. Now I'm going to ask you to touch your finger to your nose, and now touch my finger. Again. Okay, and now I'm going to touch you. If you can close your eyes and say now every time you feel it.
No. 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 No.
All right, and now I'm going to do a light touch, a sharp touch and a dull touch. Let me know when you feel dull or sharp.
All right. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull.
Okay, and then I'm going to perform the I think the Babinski, the quadricep reflex. Sit up so that your feet kind of dangle. There we go. But there we go. Okay. Okay. And it's present. Now I'm going to do the brachial reflex. Okay, and then fingers are moving, so it's okay. It's intact. All right, and then I will. Okay, so then. I'm going to then run through what I think I'm missing. And I think this should actually conclude our exam. Thank you so much for participating.
All right. Thank you.